Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Ever turned in bed, looked up suddenly, or stood up and felt like the whole room was spinning? If yes, you're not alone. That spinning feeling is often called as vertigo, and for many people, it can feel confusing, frightening, and deeply unsettling. Welcome to Steady Balance. This is episode 1. Today, let us try to understand vertigo in simple terms, what it is, why it happens, and what your body may be trying to tell you. First, one important point. Vertigo is not a disease by itself. It is a symptom. It is a false feeling that you or the world around you is moving even when everything is actually still. Some people describe it as spinning. Others may describe it as swaying, tilting, or feeling pulled to one side. It may also be accompanied by nausea, sweating, unsteadiness, or sudden fear because your sense of balance no longer feels normal. So, how does the body normally keep us balanced? Your balance depends on three systems working together. Your inner ear senses movement and position. Your eyes tell your brain what is happening around you. And your muscles and joints tell your brain where your body is in space. Your brain blends all of these signals together every second so that you can walk, stand, turn, and move safely. When these signals mismatch, you feel unsteady. When they match, you feel steady. In many people, the problem starts in the inner ear. Inside the inner ear, there are tiny balance organs filled with fluid and delicate sensory cells. The semicircular canals help detect turning movements of the head. The utricle and saccule help detect straight line movement and gravity. When this system sends the wrong message or when the message does not match what your eyes and body are sensing, the brain may wrongly think that the movement is actually happening. That false message creates the spinning feeling of vertigo. This mismatch can also cause nausea, vomiting, unsteadiness, and abnormal eye movements. So, if vertigo has ever made you feel frightened or helpless, please remember this. It is a real physical symptom. It is not imagined and it should not be dismissed. One of the most common causes of vertigo is BPPV. It is short for benign paroxysmal positional vertigo. The name may sound complicated, but the idea is simple. Tiny crystals inside the inner ear can move out of place. When that happens, rolling over in bed, bending down, or looking up can trigger sudden spinning. The good news is that this type of vertigo is common and often treatable. Another cause is vestibular neuronitis. This happens when the balance nerve becomes inflamed, often after a viral illness. The result can be sudden severe vertigo, nausea, vomiting, and trouble walking steadily. A third cause is Meniere's disease. In this condition, changes in the fluid balance inside the inner ear can interfere with normal hearing and balance signals. Along with vertigo, a person may also notice ringing in the ear, hearing loss, or a feeling of fullness or pressure in one ear. It is also important to know that not all vertigo comes from the ear. Sometimes it can be related to the brain, for example, migraine, multiple sclerosis, or in some cases, stroke. That is why vertigo should not be ignored if it comes with warning signals like double vision, that is called as diplopia, slurred speech, facial weakness, numbness, trouble walking, or a sudden and severe headache. In these situations, urgent medical attention is very important. The good news is that many causes of vertigo can be treated. Some people improve with simple head positioning maneuvers, especially in BPPV. Others may need some medicines, balance exercises, or treatment for the underlying cause. So the key message to remember is this. Vertigo happens when the body's balance signals become mixed up and the brain senses movement that is really not there. If you or someone whom you know is having repeated spinning episodes, falls, hearing changes, or severe symptoms, please do not ignore it. With the right evaluation, the cause can often be understood and the treatment can help bring confidence and your balance back.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.